I'm going to do this sitting because I think it's easier for you guys to be able to see with me sitting rather than standing with my back to you. So I'm going to sit while I do this. So the first thing we're going to do is we're going to check the doctor's orders. We are going to find out if the doctor has ordered a wet to dry dressing, where he's ordered it, the type of dressing. Sometimes they'll order packing, sometimes they'll order medications with it, ointments, those types of things. So make sure that you have checked the doctor's orders. After you do that, a half an hour prior to doing the dressing change, you need to make sure that your patients have been given an analgesic. So we're going to make sure that the analgesic is working. And Mr. Jones, how are you feeling? Are you feeling that the pain medication we've given you is helping? And, he'll say yes or no. You'll have him rate his pain. All right, then you are going to identify the patient. You're going to identify yourself. I'm Jennifer. I'm going to be your nurse today. And what is your name? And her name is Mrs. Jones. And what is your birth date? She gives me her birth date. And we are going to be doing a wound care dressing change today. So we're going to be taking that old dressing off and we're going to put a new dressing on. Okay, if you have any questions while we do that, just stop me and we'll see if we can get you comfortable. Okay, then you're going to provide privacy. You are going to raise or lower the bed, whatever's comfortable. You don't want to put them in a high Fowler's because it's a wound on their abdomen and you won't be able to get to it really well. So you're going to want to leave them. If it's hard for them to breathe, you may want to sit them up just a tiny bit. Whatever's comfortable for them. You need to get your equipment. You need your dressing change tray, your sterile one. I always get some sterile Q-tips, and I'll show you why in a second why you'll need those. You'll need a tape measure to measure the wound, and you'll need a pair of sterile gloves in case you break sterility, an extra pair, and you need a pair of clean gloves, okay? All right, so then you are going to expose only the wound itself, okay? You don't want to expose the whole patient, and if she's like me, she's always cold, so you'll cover her top half so she's not exposed and freezing. Wow, that's a lot of blanket for her. She's cold. She's really cold. Okay.
Jen, for sake of video, and with that clump of blankets at the bottom, we can't really see your wound. Just pull them down and expose her.
All right, so we're going to expose her a little bit more because, like you said, you can't see her. Okay, can you guys see that better?
That's better.
There's a thing. Okay. All right, so then we're going to put on our clean gloves. We're going to talk to the patient and teach the patient that, Mrs. Jones, we are going to be doing a sterile dressing today, which means that the equipment we have out is going to be sterile, so you need to try and not touch this area and try and not touch your wound. You don't want her also scratching at it if it itches and those types of things. So just explain to her that you're going to be doing a sterile technique and you need her to be careful to keep her hands down. If she was a violent or a confused patient, you may want somebody to come in there and hold her arms down while you do this. Okay.
4-pointer.
So then, I have a hard time sitting and doing this. I'm sorry. If you can't, can you see me if I stand?
The camera's still over here.
Okay. Oh, that's right. I keep thinking it's the camera behind me. Okay. So then you are going to slowly, you're going to hold the skin down tight while you take the tape off of the old dressing and you take the dressing off away from you. Okay? So you hold the skin down carefully, carefully, and this will help prevent skin tears on the little old people. So you're going to just hold that skin down. The dressing needs to go away. Then you're going to assess the dressing and see what's on the dressing, and then you're going to throw the dressing in the garbage. Once again, you're going to look at the dressing. There's nothing on here that I would need to report, so I would throw that away. Now this one, you are going to assess. This one has, I would say, about 2 inches by about a ½ inch of red drainage, red blood. Then I'm going to also assess the wound. I'm going to assess the integrity of it, if it's got redness, if it's got swelling, the color of exudate. We're going to also measure it. We're going to decide if it's got any odor. And when you take this out, I promise you'll be able to tell if it's got odor. So that goes in the garbage. Okay, and right here, we're going to take our little tape measure. And you can hold this to the side of the wound, but not on the wound itself, okay? And it looks like it's about 5.5 inches long. You can hold this over the wound, but you do not want to touch it. It looks like it's about 1 inch wide. Now, how do we do depth? That's where our little sterile Q-tips come in play. So you open the sterile Q-tip, take out a Q-tip, and you measure right down into the center. Put your thumb to where the skin is, and you find out it's about 1 inch deep. You'll put it right in the deepest part of the wound. Okay? Then you will also throw that away. Okay? All right. Now I'm going to dispose of my old gloves. And I'm going to explain to the patient now. I'm going to clean that out really good, and then we're going to pack it up and put a new dressing on, okay? Okay, so you come